Okay, so hi everybody, and you're very welcome to this evening's session of the Sustainable Pharmacy Network. And this evening we're going to hear from the Greater Manchester team on what they're doing on sustainable pharmacy. So just a QR code there for our general sort of network rules for the events. There'll be plenty of time for sort of questions and discussions throughout and after the presentation. Please respect everybody's viewpoints, give everybody an opportunity to speak and do sort of engage in the event as much as possible. Just going to share the QR code to our Sustainable Pharmacy Network. If you haven't already joined, then please do sign up to our pharmacy network. It's free to join. You just register with the networks in general, and then once you get accepted, you log back in and sign up to whichever of the networks you want to join. So I'm very pleased this evening to welcome the team from Greater Manchester. We have first up will be Emma Boxall, and then we also have Rob Elsey, Dr. Madeleine Winder, and Joe Altham was going to be joining us tonight, but unfortunately is not going to be joining us. But I think her team members will be referring a lot to her work throughout this evening's session. So what I'm going to do now is hand over to Emma, and Emma is going to take us through the work that they are doing in Greater Manchester. So over to you, Emma.
Brilliant. Nice to meet everybody. Rob, I don't know if you just want to introduce yourself, Maddie, before we get started.
Yeah, no, thanks, Nuala. Thanks, Emma. I'm Rob Elsey, Head of Strategic Pharmacy Transformation at Greater Manchester. So I'm hosted by one of the hospitals, but I work on lots of programmes and projects across the different trusts within the ICB. Nice to meet you all.
Maddie?
Hi everyone, my name is Maddie Winder, and last year I was working as a sustainability fellow in the ICB in Greater Manchester up until the start of September, and now I'm working as public health registrar. Nice to meet you all.
Brilliant. So I'm going to share my screen. I'm Emma Boxall, and I'm the critical care and theatres pharmacist from Salford Rail, which is part of the Northern Care Alliance, which is one of the GM trusts, but you'll hear lots about GM as we go through this evening. So hopefully you'll be able to see the slide deck now. So please give us a thumbs up, Rob, if you can see it, as then I can. Brilliant. And Rob, Maddie, if you can keep an eye on the chat. We're hoping for lots of interaction. This is us really calling for collaboration. We started small, we've extended out to GM, and now we need to take things further and move things on. So this is really a good way for us to collaborate, and we'll tell you a bit about what we've been up to and give you a couple of examples of our projects, and talk about how we've been able to do some of this with the help of people like Maddie, and then we'll mention a bit about next steps. So great, we've got some university links on the call today, because that's been a big starter for 10 for us, and we'll explain why as we go through. So it started with a bit of local interest as we came out of COVID. I couldn't bear the fact that I was throwing IV fluid boxes away. A lot of this is to start with is secondary care, and then Rob is going to eke it out to how it includes the whole ICB foot. So for those who are joining, who are not necessarily from secondary care, we'll come on to how it all links in. So it started with a bit of local interest, really. And then Lindsay Harper, who also deserves a big shout out, is the chief pharmacist of my organisation. And we were setting up a local pharmacy sustainability group, and then she's taken that forward to make it a region-wide, network-wide organisation. So with her support and her really talking to the chief pharmacists, that's been giving us a lot of gravitas to move a lot of these projects forward. So again, I can't thank her enough for that bit of it. What we did realise when we first started to get involved in sustainability, as we moved even out, we did it really for an environmental reason, but we realised we were a very small cog in the life cycle of the medicines itself. So we had to think about how they were getting to the hospitals, what was happening in primary care. to start with, and then even what was happening in the waste disposal, and how patients were starting to use their medicines properly. So hence why we've opened it out into the network. And what we really wanted to do was embed sustainability into all of the pharmacy choices that were being made, whether that be how many times the van from the wholesalers come, all the way through to what people did with the medicines when they were discharged from hospital going forward from there. So Lindsay very kindly talked to the chief pharmacist, and it was agreed we would set up a GM sustainability group. This was really to learn from all of the good pockets of practice that were going on. So in Greater Manchester, we have a brilliant respiratory pharmacist called Lynn, who was doing a lot of work with inhalers. So we wanted to spread that into the rest of GM. Other people were doing areas work on patients' own medicines, other people working on that stage at some of the anaesthetic gases. So it was really about creating a forum for sharing and starting to educate the pharmacy staff on sustainability. So we felt our role was like a cog in the wheel, feeding upwards and downwards as to what projects had been happening and how people could support each other going forward. So our sustainability group is a representation from pharmacy, from each of the secondary care trusts, and really importantly from the ambulance trust, and we'll explain why as we go through the patient's own medicine stuff. Now I want to say it's key here that these are not all pharmacists. They are some technical staff as well, so it's really, it doesn't matter who it is from the organisation, as long as they're keen and as long as each trust was represented. We then, as we see, we've got representatives from Aston on. I reached out to some of the representatives from Manchester Uni to sit on it, because we wanted to start new pharmacy team members as early as we could, so they bring those bits through. We were then also very importantly able to get sustainability leads from Manchester Foundation Trust and the Christie, and they've also been key, like we were saying to Lena, about joining the dots and converting it into something that is easily explainable to the staff. So I say Lindsay was our chief. She's off at the moment, so and has taken over. I co-chair, and then Joe and Rob work within the GM transformation group. Joe does a lot of the background stuff, which we'll come on to talk about. For those who don't know, this is what GM looks like. So it is a mix of large and small trusts, and it's fairly well spread across a wide area, but it does cover a lot of the deprived areas within the Greater Manchester, so that is a key importance when we come through that bit of it. And then, as Rob said, we really get to feed up through the providers, up through the chief pharmacists, and up to a GM level. I don't know, Rob, if you want to say something about how GM functions, because we are actually devolved ICB, aren't we? So that does give us probably slightly more eyes on of what's going on from a clinical governance point of view.
Yeah, no, absolutely. So where we see the Trust Provider Collaborative and the ICB up at the top there, we're talking about the Integrated Care Board, and the Trust Provider Collaborative is based on the chief executive essentially of the providers in secondary care and mental health and community service institutions. So the reason they're joined with dots together is because it's kind of one happy family essentially, and we kind of get to make decisions together for the best of the 3 million people who live in Greater Manchester. So as Emma says, we put things up through the system, and they get discussed at quite a high level quite quickly, which is fantastic when we're trying to move some of this work forward.
Thank you. So then coming back down to the things that I know more about, which is our group, and those are our main functions really. So we were coordinating the sustainability, we were supporting people through projects, keeping an eye on what was going on and being able to feed that back through. So that's why I was saying to Nuala about having a look at the YouTube channel and seeing what are the top tips we can pick up from there. We initially did some benchmarking just to find out what was going on. That was even from, do you use a paper bag or a plastic bag for how you transport your medicines around? And through that, we then picked out what we considered to be the key projects we could work on at the moment. So Your Medicines Matter, we're going to come back into, but we're looking at formulations. Can we make sure that maybe people use capsules and tablets rather than liquids? There's a lot of work going on in paediatrics about that, but even extending it through to adults and administration down an NG tube. IV to oral switches, which was for the antibiotic pharmacists, KPI sequin, but it isn't now, but we're still working with the antibiotic pharmacists across GM to make that into a larger project. Training we're going to come on to, and respiratory we've already mentioned. And then as Maddie's going to talk about with the RPS toolkit, when that came along, we'd almost had a little bit of a look beforehand, and we'll discuss that too. So I just want to mention the GM training to start with. So this was one of the, obviously lots of things happened in COVID, and as a critical care pharmacist I've got probably more PTSD than many people, but what was a great thing to come out of it on a call like today is the fact that Teams is really accessible to everybody. So rather than having to run individual learning at lunches within your organizations, we could run a large multiple sessions across Teams, therefore reaching out to all of the hospitals at the same time. So during the summertime last year, we ran multiple, so we ran 7 sessions over Teams, and we had over 75 different staff attend, and that ranged from the assistant technical officers, so the people who would organise the stock, if you don't know, within a hospital, through to the technical side, through to the pharmacists. We tried to make it really interactive. We used Mentimeter to get people to interact with it, and then also in none of that awkward put your hand up or like stare at people until they answered, but people felt that they could get involved in it. And we were very keen starting related to England and the local area, because I think sometimes when people talk about sustainability, they often quote a lot of the maybe global climate change, but with a lot of the pharmacy staff, we wanted to make sure we knew that they counted, and it counts for GM. So we talked a lot about even the floods that had happened and what had more recently happened. We talked about a lot of the groups that are particularly problems for us, so children, elderly, and those with low incomes. We tried to make it fun in turning it around from carbon footprints to how much a day's dose of paracetamol compared to a wine bottle that was transported around. We did it compared to various curries, whether you had a prawn curry, a meat curry, or a vegetable curry. So again, I heard people talking about that in my tea room afterwards, which was actually a really quite nice way of first introducing them to that there. We also struggled as well with the term carbon footprint. Again, how much percentage CO2 measured in tons, I couldn't compute. And Manchester has effectively what's like an M25, it's called the M60, and it goes all the way around. So we started to turn the carbon footprint into a lot of these medicines into how many times it drove around the M60, because then people could get an idea of what that actually looks like to them. So we talked about projects from people bringing their inhalers in, to the use of oral paracetamol compared to intravenous paracetamol, and weighed it up to how many times around the M60 that would be. With this, after the 7 sessions that we ran, the sustainability team members were great in offering drop-in sessions. So we ran, I think, 3 drop-in sessions where they were available, and people who had projects that they thought about after the training could come in and get some help in how they would frame that, what they might do about it, how they might turn it into something measurable. And out of that, Joe was able to pull together, and I think Nuala might have popped this onto through the network anyway. We're able to pull together what's called the Greater Manchester Good Practice Guide. So that tells you lots about maybe some of the carbon footprints of some of the drugs, some of the options, but it also goes through maybe some of the projects that we've done, other ideas, and links in great resources. So I would definitely point you in the direction of having a look at that. Brilliant. So I'll hand over to Rob to talk about patients' own medicines and your medicines matter.
Yeah, no, thanks, Emma. So in terms of Your Medicines Matter, this project was something that happened, I think, on a national level about 8 years ago. So the aim of this project was to encourage patients and family and friends to bring their medicines in with them as they came into hospital or they came in for their appointments. And it was a very successful campaign at the time. So as part of this GM Pharmacy Sustainability Group with Emma and Lindsay and colleagues and the chief pharmacist, we thought it'd be good to kind of relaunch it because what happened during COVID was obviously there was a time where you had to spray your post and leave it for 3 days to dry off because we weren't really sure what the effects are. So one of the kind of byproducts of this is it killed off the patient's own drug locker in hospitals for a while. So it was really important to try and get people to use these lockers again and bring their medicines in. So we relaunched the scheme again. And just to kind of go through some of the benefits that were true then and are true today, was making sure that hospital staff had the best available treatment for the patients to hand. They continue taking medicines they recognised ideally. And one of the kind of key things just to try and cut down on some of the waste and the time and the duplication of supplying medicines that a patient already had in a usable form. And then moving kind of through the patient stay, it was really important to make sure that that medicine was there ideally for discharge, was cut down discharge planning, but also in terms of critical meds and just making sure medicines were available for patients. So this GM campaign of Your Medicines Matter was relaunched, and also we did it alongside other kind of campaigns within the NHS of medicines waste and also encouraging the use of the NHS app in community pharmacies to get people to do patient-led ordering when they were running out of their medicines. Can you put the next slide on? Sorry, Emma.
Yeah.
Thank you. So who's this campaign targeted? So primarily, yeah, we put staff as the first one, just as our first kind of port of call and contact. And by staff, we don't just mean somebody in pharmacy. And we widen this out to the whole hospital, really. Anybody who's involved with medicines or seeing patients kind of front up and pre-admission and pre-op clinics was really important. That time game, remember to bring your medicines in. This will kind of help throughout your clinic appointments and throughout your surgery. And also, you don't know if somebody's going to end up getting admitted. That's often quite a good bit. And, in terms of the back door, the front door of the hospital, in terms of ED, making sure that people have the medicines. I know it's very difficult at that kind of critical time when you're going to go to 999 about bringing it in. But if people are able to do that, NWAS, the Northwest Ambulance Service that Emma referred to earlier, they've just done a really great audit just to kind of show about people bringing their medicines in. In terms of the wider stakeholders of the system, just making sure that different people within the primary care networks, the LPCs, the PCNs, and Jo Oldham, who we referred to as unable to be here tonight, she went up to Bury Council to their kind of scrutiny committee, and they really, really got behind the campaign of what we're doing, and they become an invaluable link as we're trying to kind of get the messages and communications out to the people, and also kind of patient-facing groups such as Health Watch, and we're trying to build up other links within patient experience groups as well. But last and not least, in terms of who we're campaigning, the targeting, it's patients, carers, family members, obviously to make sure that they have the awareness, because once somebody's come in without their medicines, it might be too late. It might not be, depending on kind of if you're able to get someone to bring it in. But, the most successful thing is if people can bring their medicines in with them. So that's the aim of the campaign, who we aimed it at. Next slide. Sorry, Emma. Thank you. So at the start of our project, of our relaunch, it's really important to do some baseline figures. And there's different current audits happening in the system. We use looking at omitted doses. But we did two specific audits to support the project. One on admission and medicines reconciliation, and another on medicines recycling. So the proportion of patients continuing on their current medicines with what they brought in and was also usable in their original prescribed in at sufficient stock, and then what was left at home, and we kind of tried to work out those percentages. So, you know, some people might have brought in some medicines, but then if it was kind of unlabeled or identifiable, then obviously that wasn't appropriate for staff to kind of be able to give that safely. So out of the total number of medicines brought in, there's 234 in total. There was £635 cost of that medicine, with 92% of that being under £4.50. But then there was a few high cost drugs in there that kind of leapt up to kind of £40–50. So it would only take kind of one high cost drug to make a massive difference in terms of the cost saving, and that duplication of effort and cost of waste alone being minimised. So for some of these items, just across a 1 day snapshot that we did, it saved nearly 12 hours of dispensing time that could be done on 12 hours worth of other prescriptions or other activities within pharmacy. And also the reduction of waste on the transfer with patients also relies on green bags to transfer the medicines between those wards and help minimise the waste of medicines. Again, that duplication of effort. Next slide, please. Okay, so this one just shows you kind of a bit of the carbon footprint profiling from that baseline audit that we did. And when you kind of start to add it up, this was just based over 1 day over every trust in Manchester. And we kind of calculated approximately using the MCF formulary that it was over 100 kilograms of carbon, or our kind of barometer we like to use, that's 21 times around the M60. So even though we use this kind of measure, we're not supporting the use of kind of car transport if you can use public transport. But it was just a nice way. And the other important thing with this data is just to make sure that we just pull out that, you know, this, because it's an evolving field measuring carbon footprints, some of the items weren't able to be kind of put into a nice low, medium or high category, such as inhalers, eye drops and liquid. But this field's kind of evolving, and which kind of carbon footprint, you know, formula we will kind of end up following will kind of come through in the next period of time as things evolve. Next slide, please. So one of the best things, or the bits I thought got the most benefits and reward throughout the system, was Jo did a whole host of road shows. She went to every site in Manchester, and she managed to dodge the photo opportunity on this as well. But so we managed to promote some of the existing policies. So she kind of, it's really pharmacy technician led, and they were able to man stands and generate interest throughout the hospital. We linked in with communications and social media platforms such as LinkedIn to kind of really get the word out there. And it led to loads of different chance meetings, and we managed to utilize this Move Beds, Move Meds came from an ATO at Tameside. It's a fantastic thing they were just doing at a local level that we've adopted now as a GM approach, just to kind of make sure that porters and healthcare assistants and different people involved in moving patients around the hospital remember to grab that bag of patients' own drugs and medicines to move it around with them. She was able to grab medical directors who wanted to know more about the campaign. And again, we've got different links with patient experience groups now. And that's kind of, you know, a testament to her excellent work doing it, kind of going out there and meeting hospital staff and patients and relatives, had so many kind of benefits as we're trying to take this campaign forward. Next slide, please. Okay, so what can the health system do to support Your Medicines Matter campaign? So just to, you know, what we want people to do is remind patients they should bring their medicines, or at least try to bring a list, or we have the summary care record or something into hospital to help us identify exactly what medicines they are, including ones that you might not end up going onto the records, or even if they're going to A&E. And we just want to minimise that waste through that patient-led ordering through the NHS app. So we're trying to influence patient behaviours by linking with the health providers such as the ambulance service to help promote this campaign. It aligns with our priority of making sure that time-critical medicines are continued. And this was really endorsed recently by the Royal College of Emergency Medicine as well. And NOAS have undertaken some recent audit work that's really shown that, this can really help and provide a significant benefit for those kind of medicines. Next slide, please. Yeah, and as Emma alluded to at the start, the focus has been around secondary care in hospital trusts, but we don't want to kind of limit to it because we've got that advantage of working in a great integrated care system. So we want to make sure that we're able to spread that message into primary care and making sure that we get different bits. So we're linking in with the discharge medicine service to make sure that when those medicines leave, that some of those messages are getting out there. Lots of these signs are going up in GP surgeries and leaflets available to make sure that people kind of have a chance to get that into. And we're trying to do a phased approach. So at the recent GM Pharmacy Sustainability Group meeting we had last week, which was excellent, we could have come up with a whole bunch of new ideas we need to now kind of progress and take forward. We've got some backing from the chief pharmacist there to roll this out into primary care. And we've already spoke to the primary care board, who are really supportive of our plans. So the next step is to roll this out over the next period of time. Next slide, please. I think we're over to Maddie. Sorry.
So much, Rob. Can you go to the next slide, please, Emma? So I'm just going to talk about the RPS toolkit for a minute. First of all, just a little bit about it, and then about how we've been using it in Greater Manchester. So some of you might already be aware about it, but the toolkit, it was published this year in April. And the aim of the toolkit is to help pharmacy staff to reduce their carbon footprint so that we can all do our part to address the current climate emergency, as well as saving money and improving services too. So the toolkit itself, it was commissioned by NHS England and it was developed by the Royal Pharmaceutical Society. There's two versions of the toolkit, one for hospital and one for community, and it's free to use, it's easy to use, and it's on the internet as well. And pharmacies can use it to self-accredit to bronze, silver, and gold levels. So within the toolkit, there are 6 kind of main areas, which you can see on the diagram on the right of the screen there. So it's got people, clinical practice, travel, resource use, ICT, and operations and strategy. And within each of those areas are actions to complete, which are at the bronze, silver, and gold levels. So for pharmacies to reach bronze level, they need to do 100% of the bronze actions. So these are the ones that pharmacies might already be doing some of them. They're slightly ones that use less resource. And then as we go up to silver level, pharmacies need to do 70% of them, and then gold, 50% of the gold actions. And that's there to give some flexibility to pharmacies into which areas they want to focus on most too. Can you go to the next slide, please, Emma? So alongside the online version of the toolkit, there is a PDF version too, which is the guide, and that has all of the content, the online content in this as well, which is makes it easy if you want to just look something up quickly. Although, like I said, the web version is completely free to register with. There's also kind of a one-pager, the checklist, and that's on the right here too. And that's to just kind of help teams collaborate. So printing it off once potentially to include in like a communal area, and just acts as a bit of a visual aid to where the team is at with getting through the toolkit. Next slide, please, Emma. So as I already mentioned, it's free to sign up. You just go onto the RPS Greener Pharmacy part of the RPS website, enter some details about the pharmacy, and choose whether you want to go for the community or hospital version. Oh, sorry, just go back one, please, Emma. Thanks. And then you can see on the toolkit, you've got the 6 different kind of areas, and each of them then lead on to the actions, and you just go through them, completing as you go. And when pharmacies have completed all of the actions or some of the actions in different areas, then you might be eligible for that accreditation. So you can see in this Made Up Pharmacy at the bottom here, they've completed 100% of the bronze actions. And that means then that the pharmacy can access a certificate, bronze level certificate, and a bronze level window sticker to kind of celebrate their success and also share to say we're doing really good work on sustainability in pharmacy. Next slide, please. Thank you. So despite the size of Greater Manchester, as Rob mentioned, it covers a population of 3 million people, 10 localities and 9 trusts with multiple sites and hospitals across the area. There's a really strong integrated working between the trust pharmacies within sustainability and the strong governance structures to support this. And Emma's already talked a little bit about the group, but I just wanted to highlight that this is a really inclusive open membership group, and the group's identified that as one of its key strengths is having this wide range of members. So the pharmacists, the pharmacy technicians, the students, the sustainability managers, both at trust and ICB level. And this inclusivity of all members of staff really aligns well with the ethos of the toolkit, in that it's for all pharmacy staff to use and be a part of. And Rob mentioned as well about how the group's really well connected into governance structures, and this means that the chief pharmacists have been super supportive of the pharmacy sustainability work, and this is filtered through to other layers of management too, and it's really helped us with using the toolkit in GM as well. So in terms of the toolkit particularly, the GM Pharmacy Sustainability Group had been really interested in the toolkit for a long while, and before publication, for example, they provided feedback on the initial drafts. And the group really wanted to use the toolkit across GM and is providing oversight for the toolkit uptake and progress across the Greater Manchester area. So to support this, each trust was encouraged really to have a lead for the toolkit, and also the sustainability managers at the trust have received presentations about the toolkit too, to help with generating buy-in. And it was worked out by the group that they wanted to use the toolkit in really 3 main ways. 1, to benchmark, 2, as a framework for sustainability work, and then 3 for reporting. And I'm going to go through these a bit now. Next slide, please. So as already explained by Emma, when the GM Pharmacy Sustainability Group was first formed, they conducted a benchmarking exercise to identify what was already being done and what more could be done in terms of sustainability. And when this toolkit was published, it was a really ideal opportunity to be able to repeat this by using the toolkit as a kind of a comprehensive structure to do this. So Trust went through the toolkit to identify what they were already doing, and just using the example here of the Your Medicine Mattered campaign and the associated audits, this really links directly to 2 toolkit actions, which you can see on the top left of the screen. So one of those is a bronze action, directly about encouraging patients to bring their medications from home into hospitals, and hospital policy allowing the use of patient medications from home during inpatient stay. And then also a gold level action, which was about conducting any audits or re-audits that improve pharmacy practice and provide carbon savings. Next slide, please, Emma. Thank you. So the benchmarking exercise, it helped the group to establish the gaps, and then the team used the toolkit as a framework to identify what they wanted to work on to undertake more sustainability action. So one action that was slightly more challenging for trusts was a bronze action, ensuring that staff completed making every contact count training. So the group identified how this could be addressed at a system level. So as already explained, the GM Pharmacy Sustainability Group had provided GM-wide CPD sustainability teaching last year, and the training now is due to be repeated in autumn this year. So the plan is to incorporate the principles of making every contact count, with the aim of supporting staff to be able to provide more holistic advice to patients and also enable trusts to complete that bronze action. And then a second action that was slightly more challenging was the bronze action to include climate change impacts in business continuity plans. So for this, a suggestions document was created outlining steps that pharmacies could take to be able to complete this action, and several of the trusts have now been able to complete it. Before I go on to the reporting, I'm just going to hand over to Rob now to explain specifically about some of the implementation at one of the trusts in particular.
Yeah, no, thank you, Maddie. So I work at the Christie NHS Foundation Trust, which is it's a larger cancer centre in Manchester. And when we were looking at that as the pharmacy group, one of the actions that Maddie's mentioned around the providing support and advice was one that we also struggle with. So we tried to utilise a combination of the e-learning sort of packages readily available. Maddie was able to do some training at one of the other sites in Manchester, like a specific session, and we were able to adapt that one at the Christie, thanks to Maddie's work, to be able to kind of run that session and just tweak it to kind of take the focus away from it being for mental health patients, for cancer patients. And we were able to do that. And some of my learnings from working through the RPS toolkit at the moment is when you're setting up your kind of group, is to make sure you try and use a group email address and not try to put the burden onto one person for the pharmacy. Then it's a good way of maintaining momentum as you kind of move around trying to go to the different levels. And the other bit is just when you're looking through some of the bits on bronze, silver and gold that actually we've probably done quite a few on silver that actually I've not thought about and marked down actually through doing the CPD training session that we're going to be involved with. So you basically probably are doing quite a lot of these things anyway, particularly with the bronze level. It's just reaching out to people like your sustainability managers and other people in different parts of the hospital, potentially with some of the gases stuff and different things to help you make sure you kind of get those bits. So it takes a little bit of work to get through it, but it's very rewarding to get through it, and it feels quite nice to get your ticker tape at the end of it. So yeah, I've really enjoyed the process. We just need to now push on to try and get through some of the other bits.
Thanks, Rob. Next slide, please, Emma. So thanks, Rob. That leads well onto this, which is about the toolkit being used in Greater Manchester to report on progress, but also to celebrate work on sustainability in pharmacy. So a report was taken to the chief pharmacist in June and another in September as well. And all trusts in GM have been making really great progress. In particular, one trust has already achieved bronze, so that's the Christie, but there are several others that are really close as well, 1 or 2 actions away. And some of the trusts have also been working on their silver and gold actions alongside at the same time, which is really, really great work. So in Greater Manchester, we found that the toolkit has been really useful for driving sustainability work. And there really are several advantages to working on it at a system level as well. For example, pharmacies being able to support each other. So for example, by sharing resource, the do want sections that can be identified and can be completed centrally or by one trust. And actions can also be done at scale to be more efficient. So for example, those CPD sessions. And also there's really clear opportunities for the scale and spread of good ideas. I'm going to pass back over to Emma now for the kind of final slides. Thank you.
Thank you both. So hopefully now people are starting to think how we could help them and vice versa. So as I say, we set up the MDT working groups in a lot of the ideas that we're going forward. We are very fortunate, just to touch on the Manchester Uni strategy. We're hopefully getting some of the undergraduate students to come and link in with some of the team within the secondary care to run some of our data for us, so they get experience of working across the sectors, to get experience with working with different types of professionals, and we get the bonus of a lot of this, probably like many people on this call, it's done a lot of it in our own time, or not necessarily allocated enough time in our job roles. So to get the students to help you crunch some data, they get a lot out of it, we get a lot out of it, and hopefully we set them on the path going forwards. How we measure it has been very key, hasn't it, Rob? And the chief pharmacists have been particularly interested in how we show that this is making a benefit, whether it be financial savings of the patient's own drugs campaign, through to maybe some of the financial savings even from the IV to oral switches. So that's a great thing that we're working with the sustainability teams about. So for example, there'd been a multiple people want to work on intravenous paracetamol and removing that and switching it to enteral. So we're just developing now a single poster that could go out with a few key people that have been able to pull that data together. So it definitely saves reinventing the wheel. And as Rob mentioned, we had a meeting last week and there's about another 10 plus more ideas that we need to work through, but we're very conscious about developing the metrics, and then we're very conscious about making this be communicated up to the rest of the ICB, but also down to the pharmacy staff working in the ward environment. So that communication strategy is key. So yeah, I think that's probably about all we want to say, because we want to leave some time for some questions. We're on 7:45 now. So yeah, so our aim was really to make sustainability part of every decision making process, and we started within the secondary care, but then we've eked it out, and it's about talking about it like we're doing today. It's about being cheeky enough, like Joe is, to go and grab whoever's walking past to say, can you help me, what do you think about this, and breaking those barriers down. So Joe, Mardy, do you have anything else? Rob, anything else you want to add?
Okay. Shall we see if there's any questions from the room, Emma?
Yeah, I stop sharing and then I can actually see.
Yeah, that would be great. So if anybody has any questions, if you want to either put up your hand or put it in the chat, do please feel free to unmute yourselves. I'm going to go first, if that's okay, because I'm just really blown away by the engagement that you've got. And because we often hear here at CSH, you know, when people working in practice, they find it really difficult to get that sort of top level engagement that sort of drives things forward, but then also people struggle to get engagement sort of at the front line, if you like, because people are just sort of so busy and overwhelmed with work. So I guess my two questions are sort of, how did you get that engagement from the sort of the chief pharmacist and that top level, and how do you get the engagement sort of at the wider sort of workforce level?
I could start that bit and then Rob could add, because he's been at the chief pharmacist meeting. At the rest of the pharmacy staff, everybody wants to do the best that they can within the hospital, and therefore it's about making it easy choices, isn't it? So it's making decisions like, for example, we're looking at whether we all use the same green bag, so that it's easy out there, purchasable, so we can make it so that that's an easy selection choice for it. So it's about educating them, and it's a bit like when everybody at home got a blue bin. They made it much more recyclable. Blue bins are what I use, sorry, for paper. In GM might be a different colour bin where you are, but as soon as you actually took the bin to the houses of people, you find that probably much more people recycle, and it's the same with that bit at ground level anyway. And then people started to have come out and said, oh, well, what about this, or what about the other? Higher up, I would say data talks and money talks. So even just so one of the big drivers to do the patient's own drug campaign was me and some of the technical staff in various hospitals. The dispensaries are really busy, really busy. It's a really stressful environment. To be in that at that point, it really affects staff morale. So that was a big driver to stop us having to redispense it, as well as the cost. So even just turning that into, well, it was 12 hours of technician time that we saved. Those are the big data points that talk to it, and it's probably about adding the story to it. So we had a patient who has had a transplant who went from Oldham Care Organisation into MFT, which is the other organ, and back, and could use the green bag. So it's about metrics and the narrative stories, I would say, that go with it. I don't know if Rob and Maddie want to add any other bits to that.
The only other thing I think that you need to kind of consider adding in is you need an Emma to start with. You need that person. Hopefully, it's everybody on this call who are going to like the touch paper and make it an issue and not be afraid. No, so it all came from, essentially Emma saying to her chief pharmacist, "Why don't we do this?" and all the things you just said there.
Yeah.
But you need to go to chief pharmacist. You need to get them bought into it. And then the chief pharmacist, she was bought into it, and then then it's easy for her to kind of get her peers and the other chief pharmacists on board. And then, it quickly gathered momentum and the whole GM pharmacy sustainability group, if I get my words out, started. It was kind of a labor of love, essentially, for Emma, and they're picking key times to run the meetings. That, it's lunchtimes on a Thursday rather than Monday or Friday or any kind of critical times for busy acute areas. So you've got to kind of work with it a little bit, but you just need to kind of have that start and that passion, and then everything can build from there. And then I just agree with everything that Emma said as well.
Yeah,
I do think you need ideally a little bit of somebody who, I won't take all the credit, because Joe, who's not on this call, is the one who make sure the minutes go out, who is the nudger, who is the everything. So if it was left to me, it wouldn't have been half as successful. But I can ask the questions. She make sure the agenda's out like 3 weeks before, compared to me that would be like, okay, 1 day to go or an hour before, here's the meeting minutes, that sort of thing. So it does need to be a massive team effort. I'll definitely say that bit makes a big difference.
Yeah, which sounds like you've absolutely got. Okay, there's lots of hands up. Can I ask people to just introduce themselves and where they're from when they kind of speak? I'll go to you first, Rachel.
Hello, everyone. Thank you so much for spending your time doing this evening. It's been really interesting, and like you said, retouching the lights, the touch paper, because I have done a lot of sustainability stuff at my hospital, but it's flagged a little bit because we've got horrendous stresses and pressures. So I'm the deputy chief at Northampton General. So it's good we've got engagement at a high level. We've got really, we're a member of the sustainability group, and there's lots of work going on. But actually the do is the challenge that we've got. So I have got a couple of sort of little questions in a way. You did talk about the training across the whole of the system, and I just wondered if that was something that was embedded into like the role specific or mandatory training. So does everybody have to do it, or how do you get that engagement to do the training? So that's one question, if I can be cheeky and throw a sort of simple-ish one in, just about your green bags, because we have green bags, but they're green plastic bags. And we have, the bane of my life is that a number of years ago, they changed in the dispensary, quite a number of years ago, 2 plastic bags to send out because they had a tracking device, tracking numbers on and everything else. So it's such a simple thing, isn't it, the bags? But actually, is it something that's sustainable in its own right? So sorry, I've been cheeky and asked 2 questions.
No, it will be we'll answer both of them. So engagement wise, the big chiefs said that people can have the time to do it not on their lunchtime, so they allocated the time for people to do it. So that was the key. And whether I'd have to speak to Jo, because she organizes the Teams call, but why that couldn't be on a more bigger than GM scale, so that you can reach everybody. I don't know why that isn't something that we go for, because you end up, don't you, like the UK CPA's membership only. It's how you almost need NHS England or somebody to go, I'm going to run 7 sessions across the country, and everybody can just tab into them, because it meant to me can take as many people as your account allows. So basically the big chief said, we are happy to support this training, people can go in work time. That was the big key for the engagement part.
Can I just jump in there? And was that training that you developed yourself, or did you? Yeah, okay.
So we happily share the slides of that. We developed it with the sustainability officers. So it would be a double act, a triple act probably. Me, Rob, and one of the sustainability officers to do those bits. So they did a lot of the maybe carbon element of it. And ran the Menti, and then Rob and I would talk about some of the projects. But a big thing was to get people thinking about what annoys them about it. And that was a big driver. So people were like, please have a think about what annoys you every day that you think we can do something about it. And lots of project ideas came out of that. We did hope to run it then as a whoever, like as a competition almost, and whoever won it would be able to present at CPC, but we haven't quite got that far yet. But that might be, to put some sort of sustainability afternoon that with all the GM projects to be shared. But that's a pipeline dream at the moment. We'll get there with that. As for the green bags, they are plastic. That is not it. Well, we struggle to find paper alternative, but the other thing is they're designed as a bag for life almost, and that's how we've got around it. So as I say, we do have certainly what we call the frequent flyers who come in, who often have a chronic disease state like a renal transplant or some other transplant, or even a lot of the metabolic patients we have in GM, they will be frequent flyers. And the green bags, then NWAS look out for them. So they are plastic, but they're the nicest plastic you can have, which the sustainability team have looked at, but they are still plastic for almost being a bag for life idea rather than a paper one that isn't as robust.
Okay, great. Thank you so much. And yeah, message in the chat going, it would be hugely helpful to share those slides, so we can talk about maybe that later, Emma, maybe getting them on the network. Next up, Sonia.
Hello, nice to see you. How are you? I'm sorry, but I think Anna was first.
Oh, you're right. Sorry, Anna. Go ahead, Anna.
I don't mind at all. It's absolutely
well, go ahead,
fine.
Anna.
Okay, I'm Anna, and I work at South Warwickshire NHS Foundation Trust in the Midlands. Absolutely brilliant, like amount of work in a really short amount of time. I've put that in the chat, but given that the toolkit's only really recently launched, I think it's brilliant work. I really liked the use of like the stats that you've got to try and drive that engagement. What would you say are some of those really big hitters? You've talked about the patient's own drugs, and I think the time in that as well as like time and money are both those really key things there. And I know I've sort of done a lot around IV to oral switch, and there's often quite a lot of savings there. Are there any other big hitters that you would say can really just help drive that buy-in? I guess particularly thinking about cost or time savings, because that seems to be where the concerns are at the minute, I think, in everyday practice.
Yeah, so one of the challenges with the kind of the costs is kind of how you measure that, and is that a true saving, or is it cost avoidance, or is it something else? And I still don't think we've fully bottomed out exactly how we market, but in terms of kind of how we try to almost sell it to the system is trying to think it in that context of that time save, like that 12 hours in the dispensary. That's pretty powerful to that dispensary. And the other thing that we find quite useful is, even though we're still debating ourselves about which carbon footprint tool to use, it's a different metric that feels, it's not quite as cold and hard and brutal as just trying to save some money for the system, but it's something that you can see gathering up and building and measuring kind of kilograms and tons of carbon saved. And I think again that's quite a powerful thing to measure, but happy to take other kind of thoughts about what other things we could do as well on that.
I think in terms of those carbon savings as well, that also leans into the the need for trust to have their green plans and to evidence work in that direction as well. So I think that also that also helps there, is even in just a purely sustainability angle.
I think maybe, don't you say, Grace would know best, but I'm sure everybody either legally or should have, because of the green plan, some sort of sustainability officer within their organisation, and they are being marked against that as to they need to achieve that. So actually it's like they're scratching our backs and vice versa, isn't it, Rob? Because like Will and Grace need to show, that's what their appraisal management is about. So it is a win really. So reach out to those people, they'll be ever so grateful to put because medicines is such a big part of NHS environmental spends as well as financial. And after staffing, let's be honest, medicines is one of the usually the second most expensive thing within the NHS, and one you can actually do stuff about. So although Annie, you've done bits of IV to oral switches, and I think we have all done little pockets, we probably need to start linking that up together. I don't know whether your organisation's like mine, where they developed this cultural drift to give things as intravenous infusions in big giving sets, where you get 25 mils of drug left in there unless you flush it through, because people see it's safer, not like there's less likely to have a reaction training wise. So that's going to be a big project for us. It's within Salford alone, so we're not even part of the Northern Care Alliance. We spend 2 million on IV infusion giving sets. It's big money. And I don't know when, I've been qualified a few years now, but I feel we used to talk about money a bit more than we did do for a bit. And we're really, certainly in GM, we've had to have our eyes on our credit card a little bit earlier than maybe the rest of the organisation, because with this devolved health system. But even just chatting, like if you talk to a lot of the junior pharmacists, they don't know how much drugs cost. So like rifaximin, so something for recurrence of encephalopathy, 322 quid for one pack. You're like, that is, you know, loads of nursing time, loads of pharmacy time. So that, I just did a presentation to the lead nurses at the Northern Care Alliance, and those were the figures that spoke. We spend 61 grand on that drug a year, just at Salford. So I don't know that people have eyes on the drugs budget as much as they, you know, like if you were saying computer systems are terrible, aren't they, within pharmacy often. If I was buying a loaf of bread from Tesco, they'd be able, Sainsbury's would say it was Emma that bought it at this branch at this time. I can't say that with a lot of medicines, but even if you start doing a bit of digging, those kind of monies now talk, because they've culled as much of the stuff out of staffing and other stuff they can do. Drugs is a big key element for a lot of we were struggling to get lead nurse involvement, to be honest, weren't we, Rob? And then we start talking about the money, and they're like, oh, let me see, what do you need to help you to make sure that we now start to give things as IV boluses rather than as infusion.
Well, you said it at the beginning, Emma, money talks, and I think that's really true, isn't it? Conscious of time, so I'll go to Sonia now for her question.
Hello for all of you, and thank you for your presentation. My name is Sonia. I'm from Portugal. It looks like I'm in the same room as Anna, but I'm not. So thank you once again. And although I have some difficulties in understanding, and I really, sadly, I don't understand everything that you say, but I have one question, and I really don't know how do you work there. But when you talk about the green bags, what is it? What is the green bag? And I would like just to share one little thing for what I am doing in my hospital. We started to use the wool wrap and make some bags. People in volunteers at home, they make the bags, and we give the bags with the medicine. When I give the medicine to the people who go to get it in the hospital pharmacy, and I kind of do some training for the people, what they do with the medicines, and to not to waste so much plastic. And even for the medicines inside the hospital, when they go to get medicines to the pharmacy, I like to say them, so to get a little box, a plastic box, so we don't always have to dispense a plastic bag to the medicine, to give it to them. And that's it. I'm sorry.
No, so let me show. If I share my screen, I'll show you a picture of the green bag. So it is probably being used. Can you see that?
Not yet. No.
Not yet. 2 secs.
It's coming.
Can
I
you see it
think.
now?
Yeah, we can.
Okay.
Yeah. So again, like Rob said, this isn't a new novel idea that was thought up by GM. This was fairly nationwide, I would say, pre-COVID. But there was a big drive as soon as COVID happened not to bring them into hospital. And as well, I think we're in this perfect storm at the moment because the nursing staff are certainly within a lot of our organisations, are really junior staff. They don't have as much time as they did. I mean, I don't know, but I looked, and in 1990s, the most number of medicines people would have would be about 7 or 8. Now it's like 23, with all of the different medicines for heart failure, diabetes, all of those kind of things. So what we found our nurses were doing, were just having a quick look and then going, oh, we can't find it, so just hitting reorder and getting it again from pharmacy, but by putting it in a bag that's really identifiable. As Rob said, we're even I'm linked up with the portering team so that the porters ask for, by the way, have you got their belongings and where's the green bag of medicines, please, so that it goes with them. And it just saves on that. So that's what it looks like, our green bag, but that is readily available. And as I say, that isn't a GMY, that was everybody did it during the early pre-COVID, and we're just picking that back up again for the multiple reasons we described, one of them being how stressed the dispensaries are and the amount it costs to replace those medicines. And if you start to talk to the nurses in like even a few, a bit of ferrous sulfate and a gliptin can end up being like 60 quid, which is a pair of night trainers. And if the patient had some night trainers, wouldn't just be going, oh, well, we just didn't bother to find them, would we? So it's about turning it into something that they can relate to, I think.
Yeah, and I think it looks like your engagement with that has been really good. So I really love that move beds, move meds thing. So everybody knows to look for the medicines and bring them with the patient, so they're not sort of getting left behind in the medical admissions unit or whatever.
The ambulance service survey that we talked about showed that was a real problem for patients, that the people particularly who have home care medicines that maybe is quite difficult to get hold of, or those that pay for their medicines, were particularly worried about bringing them in and them getting lost.
Yeah.
Within the hospital. So driving that bit of it makes a big difference.
Yeah.
Sorry, and who provides that bag? You in the hospital?
Pharmacy do, yeah. Yeah,
in the
pharmacy
hospital.
do.
Okay.
And it doesn't have to be pharmacy as well. I think at the Christie, all the wards have the codes, and almost then they order them, so then they take ownership. So everywhere should have them, and not just pharmacy. That would be the ideal state, I think, as well.
But when people come back to the hospital, the next time they bring the bag.
They bring the medicines in that bag, yeah.
And what about the? Isn't it dirt? Dirty?
It's wipeable. That's the bonus of the plastic in a way.
Sorry, can you repeat, please?
That's why that's cleanable.
Okay.
So that is one of the only bonuses of plastic, isn't it? That it is wipeable, clean. So you find that the people that some of the stuff Rob described, some of the medicines aren't in a fit state to be used for that reason, if they've not been looked after, those would be redone if they're not appropriate to be. But I would say 9 out of 10 people, their bags are usable again.
Okay, great.
Okay.
Thank you.
I think Rachel described that it went to pre-op clinic. That's where originally it all started, wasn't it? Sending them out with pre-op appointments, green bags, so that people again would be. There's probably even some PJ articles about patients' own medicines and green bags, Sonia, if you want to have a look for the older stuff about it. And yes, Anna, we do use it for TTOs too.
Okay. So I'm conscious of time. I think we could probably talk for another hour very easily about the amazing work you're doing. So really just want to say thank you so much, Emma and Rob and Maddie, for sharing the work that you're doing this evening. So we have recorded it and we will post it on our YouTube channel. Sort of going forward, I know people are really keen to sort of have the stuff that you're doing shared. Emma, Rachel mentioned the training slides. I was also thinking those great posters that you've done. Is there any way that they can be shared with other organizations? Because then that kind of just saves other organizations kind of doing that sort of legwork.
Yeah, Joe would have the drafts of that, so we can get those from there. I don't know if people can see, Rob and I did put our emails in the chat at the beginning, so we're very happy to be contacted for any further information, but we can definitely send Nuala the training slides on to you, and some of the Patient's Own Medicine campaign, because it was in various different languages, in various different colours, so that people could have see it for the
accessibility.
There's been a lot of work with accessibility and the patients about what was needed. So again, I would relate back to her for that, but we will send her an email now, Nuala, and ask her to send those on when she's feeling better.
Yeah, I mean that would be fantastic. Are they held somewhere centrally in Greater Manchester, or
I think they're only available on we've talked about putting it on a website, but I don't know if people who randomly Teams knows you from GM, doesn't it? Because Maddie, for example, even though she just finished with us, couldn't access one of the slides. So I would say somehow Teams knows where you are coming from. So Joe's the best person to talk about that.
Okay, and maybe if we can, we'll get them posted up onto the network to really share that, and we can share that round groups like Pharmacy Declares and that as well, because I think lots of people will be really interested in sort of just duplicating what you've done, because you've done such an amazing job. So yes, again, thank you so much for coming along this evening and taking your evening to share the work with us. It's been absolutely fantastic, and we really appreciate it. Just to kind of bit of a shout out for sort of next events. So for those of you who've joined us this evening, if you haven't joined the Pharmacy Network, please do sign up, spread the word. If you would like to present at a future event, or you know anybody who you think should be presenting, please do pass their information on to me. Our next event is going to be on the 13th of November, targeting particularly pharmacy students. So we have a bunch of pharmacy and dentistry students who are going to be presenting about the Planetary Health Report Card, which is a report card that students do about their universities, so what they're teaching in terms of planetary health and sustainability, and also how they're running their institutions accordingly. So if you know any pharmacy students or any healthcare students, please do make them aware of that. So just left for me to say really thank you so much everybody for coming along this evening. We'll post this up on YouTube. I'll post it on the network and on LinkedIn.